Let's be honest, navigating a medical diagnosis can feel, well, overwhelming. So today, we're going to break down a really big topic in men's health, prostate cancer. We're going to walk through the entire journey, step by step, from understanding the risks all the way to what life looks like after recovery.
Okay, so why is this so important to talk about? Let's just start with this one powerful fact. Prostate cancer is the #1 most common non-skin cancer in men. That single statistic right there shows you exactly why awareness is so incredibly critical. To make sense of it all, we've got a clear roadmap. First, we'll cover the basics. What even is prostate cancer? Then we'll get into how it's found through screening and diagnosis. After that, we'll decode what staging really means, explore the huge decisions around treatment, and finally, take a look at life after treatment. All right, let's start at the very beginning. What exactly is prostate cancer and who should be paying the most attention? Getting this foundation right is key to, well, everything that follows. At its core, prostate cancer is just a malignant tumor. And in about 3/4 of all cases, it's a specific type called an adenocarcinoma. This usually develops in the outer area of the prostate gland. Knowing this common type and its typical location is one of the first clues doctors look for. So, when we look at the key risk factors, they kind of fall into two different buckets. You've got this stuff you just can't change, like getting older or having a family history with genes like BRCA1 and 2. But then there are others, like obesity and a high-fat diet, that are tied to your lifestyle, and that's an area where you might have some potential to manage your risk.
And this is absolutely critical to understand. The risk isn't the same for everyone. The data clearly shows that Black men are 1.5 times more likely to develop prostate cancer than white men. Because of this significantly higher risk, screening is often recommended to start earlier, maybe around age 45. Knowing the risks naturally leads us to our second stop, the search for answers. How do doctors actually find and confirm prostate cancer, especially when it's so often silent in its early stages? Here is something you absolutely need to hear. In its earliest, most treatable stages, prostate cancer usually has 0 symptoms. No pain, no discomfort, nothing. It's often found totally by chance during routine checkups, which is exactly why being proactive about screening is so vital. So what does that search look like? It's a pretty clear 3-step pathway. It all starts with screening. That's the PSA blood test and a digital rectal exam. If those raise any flags, the next step is a biopsy, where they take a tiny tissue sample, often guided by ultrasound. And finally, that sample gets analyzed in a lab to confirm if it's cancer and to give it a grade. Let's drill down on that first step because the PSA test is a really big deal. Now, PSA levels can go up and down for a bunch of reasons, but doctors often use a level of 3 nanograms per milliliter as a common threshold. Getting a result at or above this doesn't mean you have cancer, but it is a pretty strong signal that a biopsy is needed to investigate further. Okay, so once a diagnosis is confirmed, the next crucial step is to understand the cancer's stage. And I want you to think of this not as some scary label, but as a map. It's the map that's going to guide every single decision that comes next. A perfect way to think about staging is like the cancer's own personal GPS coordinates. It gives doctors a precise location, telling them exactly where the tumor is and, importantly, how far it might have spread. This GPS system has 3 main parts. The first is T for tumor. This piece of the code just describes the primary tumor itself, how big it is, and whether it's still contained inside the prostate gland. Next up is N for nodes. Our lymphatic system is like a highway system running through our bodies. The N value tells doctors if the cancer cells have left the prostate and traveled to any of the nearby rest stops, the lymph nodes in the pelvis. And finally, we have M for metastasis. Now, this is the most critical coordinate. It tells us if the cancer has spread to distant parts of the body. For prostate cancer, the most common place for it to travel is into the bones, especially the spine. Beyond just the cancer's location, doctors also need to know its personality. That's where the Gleason score comes in. It's a number from 6 to 10 that rates how aggressive the cancer cells look. A low score suggests a slower growing cancer, while a higher score points to a much more aggressive disease. So with our map created from the staging and the Gleason score, we arrive at a major crossroads, deciding on a treatment plan. This is where all that information gets put into action. Now, for low-risk cancers, treatment doesn't always mean immediate action, and it's vital to know the difference here. Watchful waiting is usually for older men, and the goal is just to manage symptoms, not to cure the cancer. Active surveillance, on the other hand, is for younger men.
It involves monitoring the cancer like a hawk, with the full intention to treat and cure it if it shows any signs of getting worse. For those who do need active treatment, there are three main paths. There's surgery, called a radical prostatectomy, which removes the entire prostate gland. There's radiotherapy, which uses targeted high-energy rays to destroy the cancer cells. And then there's androgen deprivation therapy, or ADT, which is a hormone therapy that lowers testosterone to slow the cancer's growth. That's typically used in more advanced cases. And this brings us to our final section, because you see, treatment isn't the end of the story. The road ahead is all about long-term health, ongoing monitoring, and moving forward. I really want to drive this home. Finishing surgery or radiation does not mean the journey is over. Consistent, long-term follow-up is absolutely critical. The primary goal is to keep a close watch for any signs that the cancer might be trying to come back. So the follow-up plan has a few key tools. Repeat PSA tests are really considered the gold standard for catching a recurrence early. Regular DREs are also part of the physical exam. And for men on active surveillance, repeat biopsies are used to make sure the cancer isn't becoming more aggressive. We've covered the